Hello, my name is Angela Mayer, and I am currently a student at Eastern Kentucky University, attending the NSC 890 Synthesizing Evidence for an Advanced Nurse Practitioner course. And this video is to go along with the PowerPoint presentation that we created, and mine titled Depression and Exercise. The healthcare problem that I chose to focus on is depression in adolescents. And there's a quote in the King James Version of the Bible in Proverbs 15:13 that says, "A merry heart maketh a cheerful countenance, but by sorrow of the heart the spirit is broken." And this quote basically said to me that depression has been with the human race for a long time. However, a lot of research has been focused on the adult population, and I wanted to know a little more about the adolescent pediatric population. And the Centers of Disease Control and Prevention in 2019 defined depression with adolescents as, it's very normal to have the occasional sadness or feeling hopeless. That's a normal thing for a child's life. However, when children feel persistent sadness and hopelessness, they may be diagnosed with depression. So then the next question is this a national priority? In 2007, suicide was the third greatest cause of youth ages 15 to 24 deaths, according to Schaefer, Gold, and Hicks. And there are studies that have shown that 1 in 7 teens have experienced depression. And Healthy People 2020, one of their main objectives and goals is to reduce the proportion of adolescents ages 12 through 17 experiencing depressive episodes. So it is a national priority. However, mental illness, depression, and different mood disorders are still a bit of a taboo in some cultures and families. And I was wondering if there might be a different way of treating this depression for adolescents that families and parents wouldn't be as hesitant to use, and wondering if there was just a different kind of intervention that we could have. So the PICO question that I chose is, in adolescents ages 12 through 17 with depression, how does exercise, compared to the standard of care, affect the reduction of the depression symptoms within a 3-month frame? And the 3 studies that I chose, the first one was a level 1 systemic review by Carter, Morris, Mead, and Callahan in 2016. The second study I chose was a level 2 quantitative study by Edwards, MS, and Laprenza in 2016. And the third article is a qualitative study by Carter, Morris, Repper, and Callahan in 2015, which really gave a lot of meaning and purpose of to why this is a good way and thing to research. The thing I found difficult was finding enough articles that were within the time frame, the 5-year time frame, and there needs to be more research done in this area. However, the positive side is that each of these studies were able to show significant positive results of the benefits exercise had on depressive symptoms and depressive mood. So it did show that exercise is a good intervention for adolescents suffering from depression. The systemic review was able to show that physical exercise appears to improve depressive symptoms in adolescents, especially in clinical samples. And it suggests that exercise may be a useful treatment strategy for depression. In the level 2 randomized controlled trial, they said to prevent mental health decline in active individuals, consistent regular physical activity may be necessary. And then the qualitative study results said the findings suggest that preferred intensity exercise can lead to feelings of improved mood, enjoyment, and achievement, alongside benefits that transcend depressive symptom reduction. Considering mental health nurses are a key position to promote exercise in this population, and the current findings provide vital information for this purpose. That quote gave me even more value in the sense that this is something that I would like to educate my patient population on. How I plan on doing that is there is a theorist, Nola Pender. She does health promotion. She also created a health promotion manual that correlated with her theory, and it basically encourages the person that fills out this manual to help them be successful in whatever type of exercise they choose, to be successful in completing it and doing it. And so I would like to incorporate that manual in my education. The environment that I plan on using it is in health clinics with my one-on-one time that I have with my patients, and health fairs that I might be able to go to, schools, using flyers, any kind of community gathering that I'm in, to educate the population that there isn't just one way to treat depression, but that even any type of movement that we can have our children do more, it can help decrease these depressive symptoms and hopefully reduce the high acuity of suicide and improve the outcome. In a concluding statement and in closing, I basically feel that this entire research endeavor was worthwhile. It gave a lot of validity, and I believe all of the studies I found were reliable, and I plan on using all of these things to educate my patients, to educate the family members, because depression does affect not just the person that has it, but the entire family and community that is surrounding us, and it is a national priority. So I do feel that it is something that is an important thing to incorporate in my education, that exercise can reduce depressive symptoms, and through maybe filling out one of these manuals that Nola Pender has created, there'll be more success in implementing these exercise programs for my patients. This has been a good opportunity for me to learn and be able to have the more background so that I can educate my patients better. I appreciate your time, and if you have any questions, please feel free to email or let me know if there's anything else that I can help with. Thank you.